So let's walk through the steps of typically day 4. And remember, day 4, with the report of findings, like I said, is the easiest day if you got micro agreements on all those topics on day 1, 2, 3, and 4. So if you did everything well on a small level with each category, it's unbelievably easy on day 4. When you start messing up all the categories on day 1, 2, and 3, and 4, and you don't get these agreements and all these things, that's when day 4 starts to become bigger. Okay? Because remember, day 4 is when they're introducing larger obstacles of time or money. But what's happened at this point with need? Has it gone up or down? Way up. What's happened to value, their perceived value? What's happened to their understanding of time and how easy it is to get in and out of your office? Should be good. They should know that they can come in, get treated, right? So they should have an experiential part of time. They already understand money, the cost per visit, right? Not a shock. So again, what happens? Where are you at with trust? Higher, little, or a lot? Confidence? Patient's confidence in you. Little or a lot? Lot. Defenses? Resistance? So you got a lot of things working for you. Of those 4 categories, a lot of them are working for you. And the equation, what's the equation? Need relative to the obstacles of time or money and trust. Okay? So of the equation, trust and confidence naturally going high, not just because of a byproduct of multiple contacts, but because of your interaction with them. Trust, confidence, higher. Okay? Defenses and resistance, lower. Go to the equation. Where's need? You should be at the pinnacle of their need. Should you not have found their primary chief complaint and their primary ADL? Yes. And should you not have shown them how you're going to give them hope and give them the number one thing they want, which is their primary ADL to get back to normal with that specific motion? You've done that. That's their greatest pleasure hope. Should you not have done that? Should have done that. Should you have also showed them, should they also have a clear understanding at this point, the negative pain-based consequences of their permanent injury? Yes. And should they also now know the logic of exactly how you're going to take them from not having a permanent injury or minimizing their permanent injury to getting them back to 100% of the number one thing they want, called the therapies? Should they not know exactly how you're going to get them on that path? Should that not have happened by now? So where are we at with need? Where are we at with time? Looking pretty good with time, because it's time, meaning them getting in and out of the office and being in the office. Money, they understand money, what the cost is per them per visit. Value, need, obstacles, time, or money. Where are we positioned right now to now talk about higher obstacles of time or money? We're positioned really well. And all we want to do right now is to reestablish the need. Time, if you screwed up time at this point, you won't be able to recover. In other words, on day 1, if they had to wait for an hour, on day 2, if they had to wait for an hour, day 3, they had to wait for an hour, you're not going to be able to tell them, by the way, we have a 7-minute wait policy. They already know better. You already screwed that up. So in other words, you just took an obstacle and you magnified it experientially. But just the opposite happens. If they know they can walk in, come right back, or wait less than 7 minutes, and come right back and see the doctor or get therapy and leave, you've helped to create you've helped to already give a experience with the obstacle of time, which is favorable, right? So that becomes less of an issue for them because they know they can get in and out. Does this make sense what I'm saying? And then money, they already know the per unit cost, but all we're going to do is after we tally up the money, so the need's going to be here, the money's going to come up here, the money perception may even come a little higher than the need. So how are we going to overcome that? Terms. We're going to take the money, we're not going to ask for it all now, and we're going to break it down into multiple chunk payments. And that's how the need will be here, the perception of money will be here, and time will be here. And you'll have trust, confidence, up. Defenses and resistance, lower. They'll know exactly how you're going to get them back to the thing that's most important to them, the primary ADL. They're going to know the therapeutic protocol, exactly what you're going to do to get them there. And they're going to know the number one highest motivation of everything, which is what? The likelihood of a permanent injury the rest of their life. The negative pain-based consequences of that. And that's why it works so well. If you don't do that formula, if that formula is not right because you didn't have the skill level, you're not going to get the patient to prepay. They don't prepay or don't agree to the term and the payments, then you're going to get what's called market forces. That's when they just stay till they feel a little better and leave. And it's all going to be dependent on your skill level. It's not going to be based on their economics. And here's why. There's 6 socioeconomic classes. There's 6. There's only one socioeconomic class that cannot afford terms. Terms. In other words, periodic payments over time. I'm talking about as little as $97 a month. That's what I'm talking about. So there's 6 socioeconomic classes. There's only one that can't afford chiropractic care legitimately. Those are the homeless people living under the bridge. Those people don't see chiropractors. That leaves 5 socioeconomic classes. There's only 2 socioeconomic classes out of 5 that can actually pay the full amount, and that's middle upper class white collar. That's not typically your patient base. The chiropractor's patient base is blue collar, and the number one reason is they need their joints for survival, for work, for shelter, for food. That's why the blue collar person is the typical chiropractic patient. The white collar person doesn't use their joints as much, number one. And number 2, all they need to do is not work, because they typically can, or take pain medications and drugs. And they still don't use their joints as much as the roofer, the plumber. Okay? So that leaves 3 out of the 5 socioeconomic classes that cannot afford the total amount of care if you asked for it all at once. But what they can afford is terms. That's what they can afford. And they can afford as much as $97 a month, or even less if necessary. And if they can't, there's only one reason they can't. Their value system is skewed. And I'll give you a simple example. If somebody smokes and drinks 2 Coca-Colas a day, they can easily afford your chiropractic care. Pack of cigarettes is typically what, $5 now? $5 to $7 a day? Most people smoke a pack of cigarettes a day if they're smokers. $5 a day, how many days in a month? Say 30, 3 times 5, $150 people are spending on smoking, and tell me they can't afford chiropractic care. No, they can. If they drink Coca-Colas, and most people drink Coca-Colas, and the average number of people that drink sodas is 2 a day. Typical soda is $1, $2 a day, 30 days, $60. $60 a month on Coca-Cola and $150 on cigarettes. That's the average American out there. So they're spending a little over $200 for Coca-Cola and cigarettes. Your cost for care is less than $200. Do you understand how 5 out of the 7 socioeconomic classes can afford chiropractic care? It has to do with 2 main things. Do you know how to establish need and minimize the obstacles of time or money? And what's their perceived value? How well do you know how to do that? It comes down to your skill level. That's what it comes down to. The higher your skill level, the more of those people, you'll get them to be able to pay you $97 a month or $200 a month versus Coca-Cola and cigarettes.